Hello, my name is Jennifer, and I work for Interwest Insurance Services. Congratulations on your new position at MCHC Health Centers. I'm here to provide you with a quick overview of your extensive benefit package. You will have several decisions to make when you enroll. For example, who to enroll in which plan and how many of the additional options to select. For dependents, it is a good idea to have their social security and dates of birth handy, if you wish to include them on any of your plans. This is an overview of all benefits offered. The benefits you are eligible for depend on your employment status and how many hours you regularly work per week. As a part-time or temporary employee, you will not be eligible for all benefits shown. Please reach out to Human Resources Department if you have questions regarding your eligibility. If you have any questions during your enrollment, please reach out to your Human Resources Department via email or telephone. They can be reached at _HR@mchcinc.org or 707-468-2201. Remember, the benefits you select now will continue throughout the calendar year, so we encourage you to take a few moments to familiarize yourself with the plans available. You cannot change your elections until next open enrollment unless you have an IRS-approved qualifying event. These include marriage, divorce, birth, death, or if your spouse has a job change and is losing employer-sponsored benefits. You will select your benefits through the UltiPro system, and we will take it from there. Remember, California has a state mandate for medical plan benefits. You must carry essential health coverage or you will pay a penalty on your state income taxes. Let's get started. Your medical plan has two parts, one PRISM plan and one GAP plan. Additionally, the prescription coverage is provided by Express Scripts. In order for us to provide the lowest out-of-pocket cost for you, we have put together a PRISM plan that overall has a $0 deductible when combined with a GAP plan from Sun Life. You will have access to the full list of the Blue Shield PPO providers in California and the Blue Card network when out of state. The Blue Shield PPO is the largest PPO available. The PRISM plan has a $0 copayment for all preventative care, a $30 copay for office visits, and all other charges are subject to a $2,000 calendar year deductible, then 20% coinsurance to a maximum of $5,000 out of pocket for individuals. The family plan has a $4,000 deductible and a $10,000 out-of-pocket maximum. Both the deductibles and out-of-pocket maximums are combined for in and out of network. Next comes the $2,000 GAP policy. It will reimburse you for outpatient charges applied to your deductible, meaning your actual deductible is $0. If you have inpatient services, the GAP plan will pay you up to $5,000 to cover your entire out-of-pocket. We have created a quick and easy guide in order to submit a GAP claim. It is also available on the company intranet and in your benefits booklet. If you follow the instructions listed, you should have your money back before you have to pay your providers. Prescription medications are available through Express Scripts. The copays are listed here. It is a good idea and cost-saving too if you are on maintenance medication to purchase them through the mail. You can sign up online or call the number on the back of your ID card for Express Scripts. You can get a 90-day supply if you order them through the mail. You will be getting ID cards from both Blue Shield and Express Scripts, so be on the lookout in your mail. They come in generic-looking envelopes, so don't throw them away. Please make sure your address is correct in our HRIS system, UltiPro. If you need new cards, you can print temporary medical ID cards or order a new set from www.blueshieldca.com/CSAC. Your dental plan is through a company called Cypress Dental, and it is a premier dental plan based in California. It offers great benefits either in a PPO network or non-network, any dentist DDS. The network dentists charge less, so your consumer dollars go farther. Each year, you have an annual benefit maximum $1,750 per person for your dental needs. You will have the benefit of getting your teeth cleaned 2 times per year, and it will be covered at 100% both in and out of network. If you need basic services, you will have a $50 deductible and 10% coinsurance in network or 20% coinsurance at any non-network dentist. Major services like crowns are covered at 60% in network and 50% at any dentist. The out-of-network dentists are paid at the 90th percentile of UCR, making them reimbursed quite fairly. You may have additional out-of-pocket cost if your dentists charge above this maximum allowance. To find a network dentist, simply go to cypressadmin.com and look for Find a Provider. Select PPO Dentist and add your zip code. A list of nearby dentists will appear. You will be receiving your Cypress Dental ID card in the mail, but can also register for an account online at cypressadmin.com to pull an electronic copy of your dental ID card. Your vision benefits are available through VSP, Vision Service Plan. Most all vision providers participate, but you can look one up at VSP.com. You only need to pay a small copay, $10, in order to get your exam. If you need glasses or contacts, there is an additional $25 copay for materials. You are eligible for VSP pricing on any upgrades, and your frame allowance is $180. The timing of your benefits are 12 months between exams. For frames, lenses, and contacts, the frequency is every 24 months. Your vision benefits are counted on a frequency allowance, so you will need to allow 12 months between exams. Please note you will not receive vision cards in the mail, but can print ID cards from your online benefit account at VSP.com. Eligible employees are provided basic life and AD&D. The amount you qualify for will be calculated based on your salary. The calculation is 2 times annual salary, not to exceed $250,000. The AD&D benefit will double the face amount if you die in an accident. The insurance company providing this coverage is Lincoln Financial Group and is paid fully by your provider. Please note this is a taxable benefit for amounts over $50,000, and you will see a small taxation on your paycheck. The IRS requires us to tax you, but in the event of a claim, the distribution would be tax-free to your beneficiary. You also have the opportunity to purchase additional life and AD&D coverage for yourself and your family. Lincoln Financial Group is offering group rates based on your age with guarantee issue of $150,000 for you and $30,000 for your spouse if you select coverage when you are first eligible. After that, you can upgrade annually, adding up to $20,000 each year without health questions. You can buy coverage for your spouse and children if the coverage does not exceed your employee-elected voluntary coverage. We are also pleased to advise you of an employee assistance plan available for your whole family. It can provide advice such as counseling, legal, and financial advice when you need it. These services are free to you and are especially helpful during stressful situations. The plan allows for the first 3 face-to-face visits at no cost. After that, the providers can transition the care to your medical plan if more care is necessary. Lincoln Financial Group is also providing you with long-term disability insurance as well. The state of California provides what is called SDI or State Disability Insurance for you, but only up to a certain percentage of your monthly income, and for a short period of time, usually only 180 days. This is an employer-paid benefit and paid for by MCHC health centers for eligible employees. Your long-term disability coverage will pick up when the state's disability insurance ends. The long-term disability benefit opportunity through Lincoln is 60% of your monthly gross income, up to $7,500 per month. This benefit will start paying after you have been out of work for 180 consecutive days. In addition to your other benefits offered, there are affleck benefits available to employees on a voluntary basis as well. This means these benefits are paid for 100% by the employee. The current affleck benefit available to you include accident coverage, cancer insurance, critical illness, hospital indemnity, and short-term disability. The accident insurance coverage is great if you have young kids and can help pay for any unexpected medical bills. A diagnosis of cancer or a specified disease would result in the cancer insurance policy helping you and your family cope financially with any large medical bills. The critical illness plan would cover any specified health event, like a heart attack or stroke, and can help reimburse for any treatment costs. The hospital indemnity plan would help and ease any financial burden associated with the hospital stay by providing cash benefits to you and your family. The affleck short-term disability will pay an additional amount above and beyond what the California State Disability Plan pays for any qualified absence away from work. Please reach out to our affleck representative, Jason Shepard, directly at 707-462-4169 or jason_shepard at us.affleck.com if you are interested in enrolling or learning more about affleck benefits. In addition to the GAP plan, there is also a flexible spending account for medical care reimbursement and dependent care reimbursement provided through IGOE. A flexible spending account, FSA, is a tax-advantaged financial account, resulting in payroll tax savings. One disadvantage to using an FSA account is that funds not used by the end of the plan year are forfeited to the employer except for a $550 carryover for our medical care reimbursement plan. Eligible out-of-pocket medical costs that are not reimbursed by the GAP can be paid for with pre-tax FSA deduction dollars. The Dependent Care FSA will reimburse certain child care expenses. The maximum election amount for the medical care reimbursement is $2,750, and the maximum election amount is $5,000 for the Dependent Care Plan. FSA reimbursement requests must be submitted to IGOE directly, and approved reimbursements will be added to your payroll check. You have an air ambulance benefit for covered emergency air transport should you or all members of your household member be flown by a covered provider. The cost of an air transport, even with health insurance, can be several $1,000s. So this benefit can be extremely helpful should you need any type of emergency air ambulance support. You own the membership for the entire year and can take the benefit with you even if you end your employment. All full-time non-temporary employees are eligible for this standard benefit at no cost, but an application must be completed and returned to HR to enroll. You can purchase additional Fly You Home coverage for a prorated annual cost of $125 per year. This is a good benefit if you travel frequently. If you're hospitalized 150 nautical miles or more from home, AMCN Fly You Home can provide air medical transport to your local hospital of choice back home. Thank you for taking the time to review this extensive benefits package. Again, welcome to the MCHC team.